In this video, we are going to learn about stomach. We'll see about its introduction, location, shape, size and capacity, external features, parts, relations, blood supply, lymphatic drainage, nerve supply of the stomach. Stomach. It is a muscular bag. It is widest and distensible part of the alimentary canal which lies between esophagus and duodenum. It is widest and distensible part of the alimentary canal which lies between esophagus and duodenum. Location. It is situated in upper left part of the abdomen. Upper left part of the abdomen. It lies in epigastric, umbilical and left hypochondrial regions. Stomach lies obliquely in epigastric, umbilical, left hypochondriac region. Most of the stomach lies under the left costal margin and lower ribs. Most of the stomach lies under the cover of left costal margin and lower ribs. Shape. It depends on degree of the tone of its muscles and tone of the muscles of the body. Shape depends on degree of tone of its muscles and tone of the muscles of the body. It is mostly J-shaped. Size and capacity. Its length is about 25 centimeters. Capacity. At birth 30 ml. At puberty 1000 ml. In adults 1000 to 1500 ml. External features of the stomach. The stomach presents following features. It presents two ends, two curvatures, two surfaces. Two ends, cardiac end and pyloric end. Cardiac end and pyloric end. Cardiac end. It joins the lower end of the esophagus. Cardiac end joins the lower end of the esophagus. It presents an orifice called cardiac orifice. Pyloric end. It joins the proximal end of the duodenum. It joins the proximal end of the duodenum. It presents an orifice called pyloric orifice. The stomach is relatively fixed at upper and lower ends, but mobile in between. It presents cardiac end which joins the lower end of the esophagus, pyloric end which joins the proximal end of the duodenum. Two curvatures, lesser curvature, greater curvature. Lesser curvature, it is concave. It is shorter. This is right side. This is left side. It forms the right border of the stomach. It is concave. It is shorter. Forms the right border of the stomach. The most dependent part of this curvature is called angular notch or incisura angularis. It provides attachment to lesser omentum. Greater curvature. It is convex. It is longer. It forms the left border of the stomach. At its upper end, it presents a notch called cardiac notch. Cardiac notch separates greater curvature from esophagus. It provides attachment to gastrophrenic ligament, gastrosplenic ligament, greater omentum. Two surfaces, anterior surface, posterior surface. Anterior surface or anterosuperior surface, it faces forwards and upwards. Posterior surface or posterior inferior surface, it faces backwards and downwards. Parts of stomach. Stomach has four parts: fundus, body, pyloric antrum, pyloric canal or pylorus. Fundus. It is upper dome-shaped part of the stomach. It lies above the horizontal line joining the cardiac notch to the greater curvature. It is upper dome-shaped part of the stomach. It lies above the horizontal line joining the cardiac notch to the greater curvature. Body. Body lies between fundus and pyloric antrum. Body is separated from the pyloric antrum by an oblique line that extends from angular notch to the greater curvature. Pyloric antrum It is separated from pyloric canal by sulcus intermedius. It is 7.5 centimeters long. Pyloric canal or pylorus. Pyloric canal also known as pylorus. It is 1 to 2 centimeters long. It is narrow, tubular part. It is narrow tubular part. It is continuous with the duodenum. It is about 1 to 2 centimeters long. It is narrow tubular part. It is continuous with duodenum. Relations of the stomach. Peritoneal relations and visceral relations. First, let's see peritoneal relations. Stomach is covered by the peritoneum except where the blood vessels run along its curvatures and bare area of the stomach. Stomach is covered by peritoneum except where the vessels run along its curvatures and bare area of the stomach. Bare area of the stomach is a small area which is not covered by peritoneum. It is located near the cardiac end on the posterior surface. The folds of peritoneum extending from the stomach are lesser omentum extends from lesser curvature of the stomach to the liver. Greater omentum, it extends from lower two-thirds of the greater curvature of the stomach. Gastrosplenic ligament, it extends from upper one-third of greater curvature of the stomach to the spleen. Gastrophrenic ligament, it extends from upper part of the fundus to the diaphragm. Lesser omentum from the lesser curvature to the stomach. Greater omentum from lower two-thirds of the greater curvature of the stomach. Gastrosplenic ligament from upper one-third of greater curvature of the stomach to the spleen. Gastrophrenic ligament from the upper part of the fundus of the stomach to the diaphragm. Visceral relations. Relations of anterior surface. Anterior surface of the stomach is related to liver, diaphragm and anterior abdominal wall. Area related to liver, area related to diaphragm, area related to anterior abdominal wall. On the right side, anterior surface of the stomach is related to gastric impression of the left lobe of the liver. Anterior surface of the stomach is related to gastric impression of the left lobe of the liver. And near the pylorus, it is related to quadrate lobe of the liver. Left half of this surface is related to diaphragm and rib cage. On its lower part, it is related to anterior abdominal wall. Relations of the posterior surface. The posterior surface of the stomach is related to the structures forming the stomach bed. These structures are diaphragm, left kidney, left suprarenal gland, spleen, splenic artery, pancreas, transverse mesocolon, left colic flexure. Diaphragm, left kidney, left suprarenal gland, spleen, splenic artery, pancreas, transverse mesocolon, left colic flexure. Blood supply of stomach. Stomach is supplied by following 5 arteries. Left gastric artery, right gastric artery, left gastroepiploic artery, right gastroepiploic artery, and short gastric arteries. Left gastric artery, right gastric artery, right gastroepiploic artery, left gastroepiploic artery, and short gastric arteries. Left gastric artery, it is a branch of celiac trunk. Celiac trunk gives left gastric artery. Right gastric artery, it is a branch of common hepatic artery. Celiac trunk gives common hepatic artery. Common hepatic artery gives right gastric artery. Left gastroepiploic artery, it is a branch of splenic artery. Right gastroepiploic artery, it is a branch of gastroduodenal artery. Short gastric arteries are branches of splenic artery. Short gastric arteries are branches of splenic artery. Left gastric artery is a branch of celiac trunk. Right gastric artery is a branch of common hepatic artery. Right gastroepiploic artery is a branch of gastroduodenal artery. Short gastric arteries, left gastroepiploic artery are branches of splenic artery. Venous drainage of stomach. Stomach is drained by following veins. Left gastric vein, right gastric vein, left gastroepiploic vein, right gastroepiploic vein, and short gastric veins. Left gastric vein, right gastric vein, right gastroepiploic vein, left gastroepiploic vein, and short gastric veins. Left gastric vein and right gastric vein drains into portal vein. Left gastric vein, right gastric vein drain into portal vein. Left gastroepiploic vein and short gastric veins drain into splenic vein. Left gastroepiploic vein, short gastric veins drain into splenic vein. Right gastroepiploic vein drains into superior mesenteric vein. Right gastroepiploic vein drains into superior mesenteric vein. Left gastric vein, right gastric vein drains into portal vein. Left gastroepiploic vein, short gastric veins drain into splenic vein. Right gastroepiploic vein drains into superior mesenteric vein. Lymphatic drainage of stomach. The lymphatics of stomach follows four territories: area 1, area 2, area 3, area 4. This is right side, this is left side. Area 1, right upper 2/3. Area 4, right lower 1/3. This is right side, this is upper, this is lower. Right upper 2/3, right lower 1/3. Area 3, left upper 1/3. Area 2, left lower 2/3. Left upper, left lower 1/3, 2/3. 3, left upper 1/3. Area 2, left lower 2/3. Area 1, it is drained by left gastric lymph nodes. Area 4 is drained by right gastric lymph nodes and hepatic lymph nodes. Area 3 is drained by pancreatico-splenic lymph nodes. Area 2 is drained by right gastroepiploic lymph nodes and pyloric lymph nodes. Now supply of the stomach. Stomach has both sympathetic and parasympathetic supply. Sympathetic supply. It is derived from T6 to T9 spinal segments. T6 to T9 spinal segments via greater splenic nerves, celiac plexus, hepatic plexus. They reach the stomach by running along its arteries. Sympathetic supply to the stomach is vasomotor, motor to pyloric sphincter, inhibitory to remaining gastric musculature. It is vasomotor, motor to pyloric sphincter. It serves as the chief pathway for pain sensations from the stomach. Chief pathway for pain sensations from the stomach. Parasympathetic supply is from vagus nerves. Anterior vagal trunk is mainly derived from left vagus nerve. Posterior vagal trunk is mainly derived from right vagus nerve. Anterior vagal trunk, it gives three branches: hepatic branch, celiac branch, anterior nerve of letter Z. Hepatic branch, celiac branch, anterior nerve of letter Z. Hepatic branch, it supplies liver and gallbladder. Hepatic, liver. Near the liver, gallbladder is present. Hepatic branch supplies liver and gallbladder. It gives pyloric branch. Hepatic branch gives pyloric branch. Pyloric branch supplies pyloric antrum. Celiac branch. Celiac branch to celiac plexus. It follows left gastric artery. Anterior nerve of letter Z. It follows lesser curvature of the stomach. It gives anterior gastric branches to the stomach. Posterior vagal trunk. It is mainly derived from right vagus nerve. It gives celiac branch. Posterior nerve of letter Z. Nerve of Gracie. Celiac branch to celiac ganglion. Posterior nerve of letter Z. It runs along lesser curvature. It gives branches to posterior surface of the stomach. Nerve of Gracie, it arises at the level of gastroesophageal junction. It supplies gastric fundus. Functions of parasympathetic supply: vasodilation, inhibitory to pyloric sphincter, motor to gastric musculature, carry sensations of hunger and nausea. Let us now revise stomach. Stomach is muscular bag. It is widest and distensible part of the alimentary canal that lies between esophagus and duodenum. Location. It is situated in epigastric, umbilical and left hypochondriac regions. Shape. It is mostly J-shaped. Size and capacity. Its length is about 25 centimeters. Capacity. At birth 30 ml. At puberty 1000 ml. In adults, 1000 to 1500 ml. External features. It presents two ends, cardiac end and pyloric end. Two curvatures, lesser curvature, greater curvature. Two surfaces, anterior surface or antero-superior surface, posterior surface or posterior-inferior surface. Cardiac end joins the lower end of the esophagus. Pyloric end joins the proximal end of the duodenum. Lesser curvature, it is concave, it is shorter, it forms the right free border of the stomach. Greater curvature, it is convex, it is longer, it forms the left free border of the stomach. The most dependent part of the lesser curvature is angular notch or incisura angularis. At its upper end, greater curvature presents cardiac notch. Surfaces, anterior surface, it faces forwards and upwards. Posterior surface, it faces downwards and backwards. Parts. It consists of four parts: fundus, body, pyloric antrum, pyloric canal or pylorus. Fundus, it is upper dome-shaped part of the stomach. It lies above the horizontal line joining the cardiac notch and greater curvature. Body, it lies between fundus and pyloric antrum. Pyloric antrum, it is separated from pyloric canal or pylorus by sulcus intermedius. Pyloric canal or pylorus, it is 1 to 2 centimeters long, narrow tubular part. It is continuous with the duodenum. Relations of the stomach. Peritoneal relations, visceral relations. Peritoneal relations, the stomach is covered by the peritoneum all over except where the blood vessels run along its curvature and bare area of the stomach. Lesser curvature is related to lesser omentum. Greater curvature, it is attached to gastrophrenic ligament, gastrosplenic ligament, greater omentum. Visceral relations, anterior surface of the stomach is related to liver, diaphragm, anterior abdominal wall. Relations of posterior surface of the stomach, the structures forming the stomach bed are related to posterior surface of the stomach. These are diaphragm, left kidney, left suprarenal gland, spleen, splenic artery, pancreas, transverse mesocolon, left colic flexure. Arterial supply, it is supplied by 5 arteries: left gastric artery, right gastric artery, left gastroepiploic artery, right gastroepiploic artery and short gastric arteries. Left gastric artery directly arises from the celiac trunk. Right gastric artery arises from the common hepatic artery, which is a branch of celiac trunk. Left gastroepiploic artery arises from the splenic artery. Short gastric arteries also arises from splenic artery. Right gastroepiploic artery arises from gastroduodenal artery. Venous drainage, left gastric vein, right gastric vein, drain into portal vein. Left gastroepiploic veins, short gastric veins, drain into splenic vein. Right gastroepiploic vein drains into superior mesenteric vein. Lymphatic drainage of the stomach. It follows 4 territories: Area 1, Area 2, Area 3, Area 4. Area 1, right upper 2/3. Area 4, right lower 1/3. Area 3, left upper 1/3. Area 2, left lower 2/3. Area 1 drains into left gastric lymph nodes. Area 4 drains into right gastric lymph nodes and hepatic lymph nodes. Area 3 drains into pancreatico-splenic lymph nodes. Area 2 drains into right gastroepiploic lymph nodes and pyloric lymph nodes. Sympathetic and parasympathetic supply. Sympathetic supply, it is derived from T6 to T10 spinal segments via greater splenic nerve, celiac plexus, hepatic plexus. Parasympathetic supply, it is derived from vagus nerves, anterior vagal trunk, posterior vagal trunk. Anterior vagal trunk mainly derived from left vagus nerve. Posterior vagal trunk is mainly derived from right vagus nerve. Anterior vagal trunk gives 3 branches: hepatic branch, celiac branch, anterior nerve of letter Z. Posterior vagal trunk gives celiac branch, posterior nerve of letter Z, nerve of Grassi.